first off, can you just sort of explain your own background in oncology?
Sure. I'm a breast imaging radiologist. So I completed my radiology residency and then did a fellowship to specialize in breast imaging. And breast imaging radiologist, if you're not familiar with that subspecialty, we screen for breast cancer, so mammography, ultrasound, and MRI. And we work very closely with surgical oncologists to localize cancers before surgery, to help for preoperative guidance. We work with medical oncologists to assess response to neoadjuvant chemotherapy. And of course, we also perform percutaneous biopsies when we identified an abnormality to diagnose the breast cancer.
Great. So now, can you explain what contrast-enhanced mammograms are?
So contrast-enhanced mammography is a standard conventional mammogram, whether it's a 2D mammogram or a 3D mammogram, with the additional information that's added by giving contrast. So this is CT contrast that's added. So we are able to not only get the anatomic information that we get from traditional mammography, but we also get some functional or physiologic information from the addition of intravenous contrast.
So why are these sort of mammograms more effective than other options?
So like I said, it has the additional information of functional imaging. So it's similar to breast MRI, which is a very sensitive study in breast imaging. It's one of the most sensitive tools that we have, which also relies on anatomic and functional imaging. So contrast-enhanced mammography is very similar and actually performs similar to MRI in terms of having both of those added information, which unfortunately mammography and breast ultrasound is only able to give us the anatomic information.
So if patients find that their providers are using a different kind of mammogram, would you recommend that they advocate to have the contrast-enhanced mammogram used or seek out a location that has one available?
Sure. So it's actually not something that is widely available right now in the United States. There's only a handful of centers that offer contrast-enhanced mammography right now, and centers are using it in different ways. Most are using it as a diagnostic tool at this time and not a screening tool. And so we're just trying to figure out what the best use is of this tool. So I would not at this time advocate that a patient goes out and tries to find a center that has contrast-enhanced mammography. It's a tool that you should be on the lookout for the future. But right now I would want to make sure that patients don't skip or delay their annual mammogram because they're waiting for this study that's not offered everywhere.
So what would you say is most important for practicing oncologists to know about the contrast-enhanced mammogram?
I think to be on the lookout for contrast-enhanced mammography in the future. This is a study that performs similar to MRI, but is a tenth of the cost. So some patients are unable to afford an annual MRI, even though it's indicated. So they might be high-risk patients, but their insurance may not cover it for whatever reason. So I think this is an exciting modality that we can offer patients that is similar, that performs similar to MRI, but is a fraction of the cost. And it also in the future might be something that is more accessible to patients. So there's many more mammography units in the United States than there are MR scanners. And to perform contrast-enhanced mammography, you can use the standard mammo unit with the addition of some hardware and obtain a contrast-enhanced mammography. So it's an exciting tool that really might help us reach patient populations that are underserved.
So is there anything else that is upcoming in the field of breast imaging that you'd like to mention?
So really, I think that we have a lot of exciting tools in breast imaging, and we're really trying to figure out the best use of each tool. There is screening breast ultrasound, which a lot of places, including OSU, are using it for patients that have dense breasts that are of average risk. There's also some new research going on with MRI and trying to figure out if we can decrease the amount of time that a patient spends in an MR scanner. So normally a traditional MRI takes about 45 minutes, and this adds to the cost of the study. It's a very expensive study. So we're really trying to figure out whether we can shorten that study to something, let's say 3 minutes or 10 minutes, and obtain that same information in a shorter amount of time. And this will allow more patients to be scanned and will decrease the cost of MRI. So there's a lot of work going on in trying to figure out whether a fast or abbreviated protocol MRI performs similar to a traditional MR.
So looking at COVID-19, there's been a lot of research that has pointed to a downturn in breast imaging and other sorts of imaging due to patients not wanting to come into clinic. Is that something that you've observed?
Yeah, we were very concerned about that. I think that the Society of Breast Imaging and the American College of Radiology really has been trying to get the word out that it is safe for patients to return. We have sent out letters to patients and, try to track patients that were canceled during the COVID shutdown, and try to encourage patients and let them know that there are safety protocols being performed. Everyone at the breast center wears masks. Patients and providers will wear a mask. There's enhanced cleaning protocols and distancing. So it's really safe to get a mammogram right now. And after, actually my mammogram was due during COVID. I delayed and then felt comfortable getting a mammogram afterwards when we opened back up. So that is certainly something that we're worried about. We're worried about finding cancers at a later stage because of this. It's similar to any disruption in care can cause an increase in cancers that are detected at a later stage, unfortunately. So we're really trying to get the word out and encourage patients to come back and get their mammogram. And we actually had a surge in the number of mammograms offered afterwards. So hopefully hopefully it worked. We don't have the data yet to see because it happened just recently.